Okay. Here I am with a series of announcements that I'm making. And again, all of you all on Facebook Live, I need you all to share this because we are definitely making these announcements and I'm excited about it. These are the people that I believe God is using during this time to bring Mound Bayou from the bottom and taking us to the top. Amen. There's great things that's going to be happening all around Mound Bayou, so you might as well get ready. Now, for those of you that's voting, I want you to make sure that you vote for people that have a vision. Yeah. It's important because where there is no vision, the people perish. So it's important that you have a vision. Don't vote for people that don't want to take you anywhere but backwards. Make sure that you vote for people that's going to take you forward. And I want to share with you, I'm pregnant with a vision of great things happening in Mound Bayou. So you just need some good pregnant people that's pregnant with a vision that's going to take you somewhere. If they can't see it, they can't take you to it. All right, so here again we have Dr. Ellsworth James and we have Dr. Hubbard, who both are working with this Delta Health Center, and because we have such strong health disparities and problems with our health, Mound Bayou is going to become a center of medical stuff. It's going to become that center. I'm prophesying to you as well, that this place is going to be a center where we can research what's happening with black people and the health problems that we're having. These young men have been working over a year, about a year now, working with a health disparity center along with the Delta Health Center, and I'm just going to release this now and let them tell you about it. Dr. Hubbard.
Well, once again, thank you to Mr. Mayor for allowing us to kind of briefly chat about this. This is such an exciting opportunity. For those of you who don't know, Mississippi is the most unhealthy state. And the Delta here in the northwest portion of the state is the most unhealthiest portion of the state. So what better place to understand health disparities, issues with people who are melanin dominant, and understanding how we can better provide health and community-oriented health programs, and then to come and study those people here. So Dr. James was nice enough to pull me in on this project. I'm super excited about the opportunity. We're not only going to study the physiology of our people, but we're also going to study the psychology of our people. And I'll let him talk about also understanding the genetics of our people.
Very, very important that we look at not just who we are, where we came from, how we got to be here, but how it impacted us, how that environment has impacted us. My name is Dr. Ellsworth James. I'm the managing director of James Velox and James, and I wrote the theory on cultural genetics, the impact of environment on epigenetics. Now, this is a 1,000-foot level looking down at what happens to people when you change their environment, when you take them from their cultural genetic norm and put them in a different situation. They adapt. Sometimes those adaptations are positive and sometimes not so much. But we have to study them to find out. And here in Mound Bayou, that first started, that the first change was in the 60s with the formation of the Delta Health Center. It provided the basis of what we call environmental public health. It was groundbreaking then, and it's groundbreaking now because it will be the site of the Research Center for Health Disparities. On a broader level, we're looking at genetics, how that changed African Americans, how they reflect that environment. More importantly, how that relates to or translates to health disparities. Speaking to that, Dr. Hubbard will be looking at various areas where you have an impetus, a change, and the evolvement of that change into what we call health disparities today. it's not just health, it's not just genetics, it's sociology, it's physiology, it's emotional psychology. All of these things are broadly attached to one another, and in order to understand the experience coming out of slavery and what that actually means physically, to the physical, the physiology, and the emotional being of an entire population, it must be studied directly. And you have research centers for lung cancer, you have research centers for diabetes and various other illnesses. This will focus specifically on that experience, and it will give answers to questions that have never been asked because there was no one there to ask that question. Well, we have people there now that can ask the questions and actually do the research. Good research, good science is good observation, and that's what we're doing here.
So some of the key diseases that we're going to be researching are what? What are some of those key diseases again?
Diabetes, high blood pressure, and heart failure. There are many, but these three impact us at rates higher than the general population. Right. We have new medications, we have oncology, but we still don't know how it happened. And until we do that, we won't be able to change it going forward, which means that future generations of those with African American genetics are going to suffer the same thing.
Right. Right. So again, thank you so much. Yeah, and talking about the obesity and some of those other problems that we have, because Mississippi is one of the fattest states in the country.
Well, speaking directly to that, the Alaska Natives, the American Indians, and the African Americans are all in the same boat when it comes to nutrition and the negative impact of nutrition on subsequent generations. You see, when slaves were brought from West Africa, lots of things were going on in Africa at that time. And the diet that we had here was nothing like what we were used to.
Exactly.
Same with Native Americans. When they were brought into the intern camps and put on the reservations, their diet was changed dramatically because their land was taken from them. So the impact of nutrition on the cultural genetic norm adversely impacted subsequent generations. These are things that we have to look at.
So we're looking forward to getting that research center right here in Mound Bayou, Mississippi. So tell us that how does it look as far as getting this to happen here, and how quick?
Well, we are actually doing we've done the methodology. We have our group of scientists and researchers together. We have people still joining the team, but the team has been consolidated. Now we have the division leaders, and those division leaders are looking at their scopes of work, their scopes of research. They're going to start writing articles on this research, and each one of them will be funded by the NIH, National Health.
National Institutes of Health.
There you go. Each division leader will have their projects, and they will be funded. They'll have their staff, and it'll be all under one roof. So you have genetics on one side. You have tissue banking, doing other things. We'll be talking about obesity and blood issues and so forth, and all of that will happen right here. Once we have, I think someone at the Delta Health Center is actually working on those instruments right now. The National Institute of Health has a myriad of tools and financial instruments that will go for supporting the individual research. And then you have the larger grants that will actually build a facility. We have 20 acres that the Delta Health Center has put aside for this center.
So we're looking forward to having, again, boots on the ground, even with Delta Health Center. So we're excited about that. Y'all, let's just give them a hand for working so hard. This is right here in Mound Bayou, Mississippi. Thank you. Make sure that you share this here on Facebook. Make sure you share it, let everybody know this is real and this is happening in Mound Bayou, Mississippi.